All right. Hi, everyone. It's Olivia Hennessy, again, for the New England QIN-QIO. I'm going to go ahead and mute all participants. You should hear a command that your phone line has been muted. Maureen, just remember that you have to press #6 to unmute yourself after you hear that command. Thank you.
A leader has muted your line. To unmute your line, press #6.
Good afternoon, everyone. Good afternoon, everyone. My name is Maureen Marcella from the New England QIN-QIO. I'll be moderating today's webinar. Thank you so much for joining us today for the 2016 case studies from NHSN Catheter-Associated Urinary Tract Infection Surveillance Training. Before we get started, I'm going to quickly review a few housekeeping items. First of all, this call will be recorded for training purposes. I'll provide you with the details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation. We will take questions at the end, and I will provide you with instructions on how to unmute your line. We would like to encourage you to post questions using the chat feature. It's on the right-hand side of your screen. Please make sure to send your messages to all participants. We are unable to see things that you post in any other area. So therefore, where it says all participants, please post it in that area, and then we will see it. And we do have someone here monitoring that area also. We have a lot of polling questions today, so for the sake of time, we will be going through them extremely quickly. So please follow along accordingly. And also, don't put your slides forward and cheat, because you do have the answers. It was the only way we could do it. We couldn't quite do it like they do it at NHSN. So to move forward, let me introduce our speaker. Her name is Susan Steeves. She is an infection preventionist at Miriam Hospital, which is a lifespan affiliate here in Rhode Island. She's a graduate from Sims College in Boston and has her master's in nursing as a clinical nurse leader from URI. She started in med-surg and then worked her way up to critical care, specializing in open heart surgery. And she joined the infection preventionist team at Miriam in 2013. Also in the room today, and as another subject matter expert, is Barbara Pashnik. She also is an infection preventionist at Miriam Hospital. She graduated from Rhode Island College in 1991 with a bachelor's degree in nursing, and she has worked at Miriam since then. She's been in the infection control since 2007. She also is the award winner of the Henry Isman Nurse Leadership Award for all the work she did in CAUTI and CAUTI competencies at Miriam. I'm going to now pass the ball over to Sue.
Okay, good afternoon. Welcome, everyone. As Maureen said, I'll be sharing some of the examples that were presented in March at the NHSN training sessions of the CDC. I'm going to be focusing primarily on the catheter-associated UTIs for today's presentation, namely SUDI and ABUTIs. We'll go over some definitions, criteria, case studies. The case studies are taken directly from the training slides. Some you'll be able to see can be a little challenging to interpret accurately. Okay. So, go to the first slide. Okay, so definition, SUDI 1A. That's a symptomatic urinary tract infection. Let's go back where we were. Yep, sorry. Oh, okay.
Sorry.
All right. Okay, good. So there are two types of UTIs. SUDIs, which is symptomatic UTIs, and asymptomatic bacteremic UTIs, which are abbreviated ABUTIs. Both types if catheter-associated, must be reported as part of any CMS CAUTI reporting requirements. Okay, just trying to get the slide working properly. Okay, so here's some specifics on SUTI 1A. So that's specifically the catheter-associated. So the patient must meet 1, 2, and 3 of the following criteria. Number 1, the patient had an indwelling catheter that had been in place for greater than 2 days on the date of event. The day of the device placement is going to be considered day 1. Also, it needs to either still be present for any portion of the calendar day on the date of the event, or the Foley has to be removed the day before the date of event. And if I can just say, the date of event is defined as the first element used to meet the NHSN criteria for the first time in the infection window period. Okay. The other criteria that has to be met is the patient has to have at least one of the following signs and symptoms. A fever greater than 38 Celsius, and that corresponds to 100.4 Fahrenheit. Suprapubic tenderness, postural-vertebral angle pain or tenderness, and those two are with no other recognized cause, or urinary urgency, urinary frequency, or dysuria. And those 3 symptoms cannot be used when the catheter is in place, just because sometimes the catheter can cause those symptoms just by its mere presence. Okay, and the third piece of criteria that has to be met is the patient has to have a urine culture with no more than 2 species of organisms, at least one of which is a bacterium of greater than 100,000 colony-forming units per milliliter. Now, all of these elements of the UTI criteria must occur during the infection window period. And I'll just stop and remind you that the infection window period is the 7-day time frame during which all the criteria must be met. It's going to include the date of the first positive diagnostic test, the 3 days before and the 3 days after. Okay? So here is our first example of a SUTI 1A. So day 1, the patient is admitted to ICU. On day 4, the Foley is inserted. On day 8, the Foley is removed and the patient complains of burning pain when voiding after the Foley removal. On day 9, there's no Foley in place and he has a fever of 100.9 Fahrenheit. Then on day 10, he has a fever of 100.5 and his urine culture is positive for 100,000 Enterococcus species. Okay, so here's our first voting slide related to the example we just went over. The burning pain on urination documented on day 8 after Foley removal can be used to meet the NHSN SUTI 1A criteria. Is this true or false? So on the right side of your computer, you can just click to vote, and then hit submit. After you vote, at the bottom there's a submit ink. And we'll just take a few more seconds and see how people are voting. We'll give it a few more so everybody gets the hang of the process. Okay, so the voting is closed. Do we know how people voted? Okay, we don't see how people voted.
This is Olivia. I just want to remind everyone, if you could please, after you have pressed true or false, press submit. If you don't press submit, then it takes another 20 seconds. Okay, now we have the results.
it looks like most people thought it was true. So, the answer is true. So that's good. Dysuria, or painful urination, can be used to meet SUDI 1A criteria because that symptom occurred after the Foley was removed. So that was good. Okay, great. All right, here's a follow-up question to that same example. This patient has an NHSN CAUTI, true or false? All right, so the polling is open. You can click A or B, and just remember to hit submit after you vote. And we'll get a sense of how everyone is doing. We'll give it a few more seconds. And just remember to hit submit. Okay. And here we are. The polling is closed.
And we just have to wait a couple more seconds. Not everyone pressed submit, unfortunately.
Okay. We'll get the hang of it. All right. So we should be just about there. Okay. There we go. So it looks like the majority agreed that it was true on NHSN CAUTI. And the answer is true. And the reason is the positive urine culture on day 10 sets the infection window period. So if you remember, that's that 7-day time frame. Dysuria is identified as the first element during the infection window period. That was on day 8, so that's going to be your date of event. The date of event was the day the Foley was removed, and at that point, the Foley had been in for greater than 2 days, so it is indeed an NHSN CAUTI. Okay, good job. Okay, here's another example. Patient is admitted to ICU on day 1. On day 4, the Foley is inserted. On day 8, the Foley is removed, but the patient is unable to void. So, on day 9, the Foley is reinserted. We have a temperature of 37.8. The next day, on day 10, the patient complains of frequent urination, so the Foley's still in. The urine culture is collected, and it shows 100,000 CFU of E. coli. On day 11, antibiotics are ordered for physician diagnosis of a UTI, and on day 12, the Foley was removed and the patient was discharged. Okay, here's a voting slide. You can open the polling, Olivia. The patient's complaints of urinary frequency documented on day 10 while the Foley catheter is still in place can be used to meet the NHSN SUDI 1A criteria. Is this true or false? And just remind you again, after you hit true or false, click submit so we can get through them a little quicker. All right.
So sorry, Sue. It looks like, again, we're just going to have to wait about 10 more seconds.
All righty. Give everybody a chance to click in. See what everyone's thinking. And it looks like the majority of people thought this was false, not in NHSN SUDI 1A. And they're right. Urinary frequency cannot be used to meet the SUDI 1A criteria as it occurred while the Foley was still in place. Great. And a follow-up, SUDI 1A, example number 2. This patient has an NHSN CAUTI. Is it A, true, or B, false? And then click your true or false, and don't forget to hit submit. All right, looks like we need a few more seconds.
Almost there.
Okay, so some people said true, but the majority said false, I would say. And the majority was right. This patient does not have an NHSN CAUTI. The rationale being the positive urine culture on day 10 would set the infection window period for that time span of day 7 to day 13. The patient has no symptoms of a UTI since the fever is not high enough and the urinary frequency is not a symptom when the Foley is present. There's no matching blood culture to identify an ABUTI. So now we're going to talk about ABUTIs. Okay, so that would be asymptomatic bacteremic UTIs. And again, the patient is going to need to meet 3 different criteria in order for it to qualify. So a patient with or without an indwelling urinary catheter has no signs or symptoms of a UTI 1 or 2, according to age. A note, though, that patients over 65 years old with a non-catheter-associated ABUTI may have a fever and still be able to meet the ABUTI criterion. The second thing is the patient has a urine culture with no more than 2 species of organisms, at least one of which is a bacterium of greater than or equal to 100,000 CFUs. And the third thing that has to be matched for this ABUTI is the patient has a positive blood culture with at least 1 matching bacterium to the urine culture, or meets LCVI criterion 2, which is lab-confirmed bloodstream infection without a fever, and with matching common commensals in the urine. So all of these elements of the ABUTI criterion must occur during the infection window period. Okay, and just a reminder that only events with catheters in place for greater than 2 calendar days on the date of event are catheter-associated and are reportable if the location is in your monthly reporting plan. All right, so here's our first example regarding ABUTIs. On May 15th, a 48-year-old male was involved in a motorcycle accident. He had a closed head injury, multiple fractures. He status post-open reduction, internal fixation, and evacuation of a subdural hematoma. Foley catheter and left subclavian catheter are in place on admission to an LTAC for continued ventilator care. His lungs are clear bilaterally. On May 21st, about 6 days later, his max temp is 99.8. His lungs are clear bilaterally. The Foley remains in place and is draining clear yellow urine. The patient remains ventilated, though his sputum production is slightly increased. On May 22nd, his max temp is 100.4. Vent settings remain stable. No change to sputum production. On May 23rd, his temp max is 100.4. His white count is up to 14,000. Lung sounds are clear. Chest x-ray is clear. He's still on a ventilator. He still has a Foley and a central line in place. We decide to pan culture him and empirically start antibiotic treatment. On May 24th, the urine culture is greater than 100,000 of Pseudomonas aeruginosa and greater than 1,000 of Candida glabrata. Blood culture shows Pseudomonas aeruginosa. His physical assessment is normal, and no patient response to suprapubic or posturovertebral angle palpation. Okay, and this little table just puts it in a different format that you can see when the Foley was inserted, his temperature trending, when the cultures were sent, and the results of the cultures. Okay, so let's vote on this one. So does this patient have a UTI? And I think you can open the poll, Olivia. If so, what type and what pathogens would you say? Is it A, no UTI? B, yes, it's an abudi with Pseudomonas aeruginosa and Candida glabrata. Is it C, it's an abudi with Pseudomonas aeruginosa? Or is it D, it's a Pseudi-1A? So if you can choose one of those, A, B, C, or D, and press submit, we'll get a sense of what everyone's thinking. Don't forget to press submit. All right, that one's a little more complicated with all the days and symptoms and... Okay, so let's see. It looks like most people, if they had to choose, would choose C, an abudi with Pseudomonas. And yes, that is true. It is that. Can you push the next slide? Okay, this repeat infection time frame template you can get on the NHSN website. They have these worksheets that you can have access to either electronically or manually, and you can plug in different information. So on this you can see that you put in the urine, the positive lab results, and then you have your infection window period, and you have no symptoms. So you can see that this meets an abudi with Pseudomonas. And the other point is that the Candida is an excluded pathogen for UTI. A few years ago, they decided that he was no longer a uropathogen. So, all right. And a little bit more rationale. Patients without UTI signs and symptoms in the presence of blood culture and matching urine cultures with the right amount, greater than 100,000, both within the infection period, it's an abudi. The Candida species is not a pathogen for UTI, therefore it's not documented in the pathogen list. And another key point is that the fever has to be greater than 100.4 to meet the fever requirements for NHSN definitions, not greater than or equal to, but greater than. Okay, here's another example. On January 17th, a patient age 73 is admitted for an acute MI. On January 18th, he has positive blood cultures with Staph aureus, a fever of 101, and a Foley catheter is inserted. On January 21st, he has a positive urine culture with Staph aureus greater than 100,000 and no UTI signs or symptoms. All right, so this is, again, it's in the template, and you can see that it meets the non-catheter-associated abudi, and it's present on admission because it was collected the day after he came in, and that's when the Foley was placed. There would be a secondary BSI, and the repeat infection time frame is set, so it falls within that. All right, and again, the repeat infection time frame is a 14-day time frame in which no new UTIs can be reported, neither Pseudis nor abudis. The date of event is day 1, and any additional eligible pathogens from urine cultures are added to the event. So you wouldn't call a new CAUTI, you would just add the new cultures to that existing one for that 14-day time frame. Non-catheter-associated SUDIs or booties, or if they're present on admission even, would set a UTI repeat infection time frame and a secondary BSI attribution period. So you do not change the catheter association during the UTI repeat infection time frame, even if they get a CAUTI after you call a present on admission or a non-catheter associated. You cannot upgrade, so that can be a good thing. Okay, and here is another one of our templates, and it shows a patient with a fever, and this one meets the SUDI 1B, which is, the one we weren't talking too much about, the non-catheter associated UTI present on admission. And even though later on the Foley's in long enough and a positive culture, you're not going to change the device association during this RIT. It does not become considered catheter associated for NHSN purposes. And review, again, key concepts. Catheter-associated UTIs are UTIs where an indwelling urinary catheter was in place for greater than 2 calendar days on the date of event, with the day of device placement being day 1. And an indwelling urinary catheter was in place on the date of event or the day before. If an indwelling urinary catheter was in place for greater than 2 calendar days and then removed, the date of the event for the UTI criteria must be the day of discontinuation or the next day. Okay, discontinuation and reinsertion. If a Foley catheter is discontinued and a full calendar day passes before the Foley is reinserted, then the day count for determining CAUTI begins anew. Otherwise, the day count continues from the previous catheter. So if it comes out one day and goes in the next day again, that's still all one encounter Foley-wise. If it comes out on one day and then a whole calendar day passes, it goes on the next day, then you start fresh. It goes by days, not hours. All right, here's another example, a device-associated example. January 7th, a 57-year-old patient is admitted. January 8th, his temperature is 100.9 and a Foley is inserted. On January 9th, the temp is up to 102. On the 10th, he still has his Foley. He still has a fever of 100.9. On the 11th, still has his Foley, still has a fever. On the 12th, still has his Foley, and a urine culture is collected. And it turns out to be positive for 100,000 coag negative stats. All right, so here's another voting slide. This patient has a CAUTI, true or false. When you click true or false, don't forget to hit submit.
Have that Jeopardy music.
I could.
You have to tape it and have it right ready.
Yeah. So that awkward sound. All right. So looks like we're going to need a few more seconds to get it finalized so we can see what people are thinking. Okay, so, it looks a little bit close. More people think it's false, but it's within just a few votes. It is false. This is a healthcare-associated UTI, which is non-catheter-associated by NHSN definitions. The date of the event January 9th is hospital day 3. At that point, the Foley had not been in place for more than 2 calendar days. Okay, we'll go on to another one. Day 1, patient went to ICU. Day 4, Foley was inserted. Day 8, the Foley was removed. Patient is asymptomatic. Day 9, there's no Foley in place. We have a fever of 100.5. Day 10, we have a fever of 100.5 and a urine culture of 100,000 ECQM. So we'll vote again. We have another voting slide. This patient has a CAUTI, true or false. And don't forget to hit submit after you vote. It looks like we're getting there. Yep, we might need a little bit more time for the votes to be tabulated. Okay, most people think it's true. And it is true. This is a CAUTI. The date of event, day 9, was the day after the catheter was removed and the catheter was in place for more than 2 days. Okay, here's another device-associated example. Day 1, patient was admitted to ICU. Day 4, the Foley was inserted. Day 8, the Foley was removed. Day 9, the Foley was reinserted. And day 10, we have a temp of 100.6, a urine culture of 100,000 E. coli. Okay. So now vote. This patient has a CAUTI, true or false? And I'll remind you to hit submit again. Still figuring out the vote. Okay. All right. Most people said true. And it's true. This is a CAUTI. Day 10 is the date of event. This patient has had a Foley in place for more than 2 calendar days on the date of event. There was not a full calendar day without a Foley in place. Okay, so this is just another example. A patient age 55 was admitted on October 5th. He had his Foley in place from October 5th to October 10th, and then again from October 12th to October 29th. The time span of 10/9 to 10/21, he had a greater than 100.4 every day for fever. It looks like he had 3 different urine cultures. On 10/11, his urine was negative. On 10/15, he had Proteus mirabilis greater than 100,000 and Staph aureus. And on 10/19, he had urine with E. coli greater than 100,000 and Proteus greater than 100,000. All right, so This is not a voting slide for this, but the Foley catheter was not in place for a full calendar day on 10/11. So the Foley count is going to begin on with the second one on 10/12. The 10/15 positive urine culture is going to set your infection window period of that 7-day time frame from 10/12 to 10/18. The fever on the 12th is the first element used to meet the UTI criterion. So this is going to be your date of event. The Foley's not been in place for 2 days on the date of event, nor was it removed the day before the event. So this is going to be one of those SUDI 1Bs, which is the non-catheter-associated UTIs with the pathogen of proteus. The UTI repeat infection time frame will be set for 10/12 to 10/25. So that third positive culture on 10/19 with the E. coli is just added to the event. It's not going to be upgraded or anything like that. It's just added in because it falls within that time frame. All right, and then there's a couple of case studies. This person had a Foley catheter in place for more than 2 days and a fever greater than 38 degrees Celsius. Urine culture was collected. It was positive for 100,000 Klebsiella pneumoniae and Citrobacter pyogenes. On February 3rd, which would be the 6th hospital day, another urine was collected and it was positive for 100,000 Klebsiella oxytosa. Okay, here's another loading slide. This patient has a CAUTI with the date of event being February 1st. Is this true or false? Click A or B and click Submit on the right side of your screen. All right, the majority of people said true. Having some technical difficulties.
I can't move it forward.
Seems to be frozen. Sorry, hold on 1 second. Sorry to hold everybody up.
Great.
Hold on.
Hi, Sue. It's Olivia. Are the slides not moving forward for you?
They're not. We got it. We got it. Sometimes you can hit escape and it goes out.
Oh, sorry, everyone.
Okay, so we noted most people said true, and that is true. So just a little rationale. This patient meets criteria for UTI on February 1st with a fever, positive urine culture greater than 100,000, and there's not more than 2 organisms. The Foley's been in place for more than 2 days, so it is a CAUTI. The February 3rd positive urine culture with greater than 100,000 falls within the UTI repeat infection time frame, so the pathogen is added to the February 1st event. And just a note not to total the number of organisms from the multiple cultures. All right, here's another case. Day 1, a 58-year-old patient is admitted to a rehab hospital from an acute care hospital with an indwelling urinary catheter in place. This is on January 26th. On day 2, patient cites a temp to 38.6. The indwelling catheter remains in place. On day 3, the urine specimen is collected, and on day 4, the results turn out to be 100,000 Pseudomonas aeruginosa, and antibiotics are started. On day 5, the patient is now asymptomatic and afebrile. So, is this an HAI for the rehab hospital? Is this a hospital-acquired infection for the rehab hospital, which is where he ended up? True or false? And submit.
Just about 10 more seconds. Everybody pressed submit last time, but looks like we missed it this time.
We got good. Oh, well.
Hi, everyone. This is Carol Dietz from Connecticut. I challenge all those people that are not responding at our next polling question. Let's see if we can get up over or get down below 50% of those that have not responded. That would be outstanding. Thanks.
Okay, so the majority of people said false. And that would be correct.
Doing this again?
You have to escape.
It's on the keyboard. Get it,
Maureen, if you feel more Sue, if you feel more comfortable with me advancing the slides for you for the remainder of the webinar, you can hold that little green ball down and click and drag it next to my name, and I can forward the slides for you.
I'm not uncomfortable. It just,
here we go.
It just
It's just gets sticky every once in a while, I think. Okay, and then the next
trying to
one.
test people on the line here.
Okay, perfect. Okay, so false. It is not an HAI for the hospital, rehab hospital. The date that the first element of the UTI criterion occurred for the first time during the infection window period was on day 2 of hospitalization. So the date of event is day 2, and this is within the present on admission, POA time. Okay. Case 3. A 77-year-old female was admitted on July 1st for heart failure. She was placed on Lasix and a Foley was inserted. On July 2nd, she complains of dysuria. On July 4th, her urine culture is positive for E. coli greater than 100,000. And on July 5th, her fever is greater than 100.4. So, voting slide. What is the UTI determination? Is it... No, this is not right. No, these are 2 I needed to get out.
Okay. We're going to skip over this. This is a repeat. Never mind about that. Okay. This is it. It meets the criteria.
Okay. Yes, okay. This meets SUNY 1A CAUTI. On July 4th was the date of event. It's a hospital-acquired infection. The dysuria on July 2nd is not an eligible symptom while the Foley catheter is in place. The next UTI sign or symptom in the infection window period is the fever on July 5th. This fever can be used in this patient over 65 years old because the Foley catheter was in place for greater than 2 days. Okay, case number 4. I think this is our last one. On January 6th, patient was transferred from an outside hospital with a Foley in place. On January 8th, the temperature was 100.8. On January 9th, the Foley was DC'd. And on January 11th, the urine culture was greater than 100,000 proteus. So, let's see if we can get everybody to vote on this one. Is this a CAUTI? True or false? And then hit submit. All right, time's up. Let's see. All right, we'll give it a little bit more time for the votes to get tabulated. Okay, so this one's split a little bit more. Most people say true, but quite a fair amount say false, too. And I think this is one of those trickier ones. Yes. Even though the positive urine culture occurred 2 days after the Foley catheter was removed, the fever on October 8th was the first element in the infection window period. So that's going to be your date of event. And on the date of event, the Foley catheter was in place for greater than 2 days. So this does meet the NHSN CAUTI criteria. And that was our final slide. You'll see on your slides that there's some resource material. The first link is for additional training. There's CAUTI, and also on the NHSN site, you can look at the other hospital-acquired infections as well. And then the UTI protocol specifically is on the second link with the manual. And I would really urge people to go on the NHSN website because there's really a lot of resources available. They put frequently asked questions for the different infections, and there's YouTube videos, and there's, the different worksheets and that kind of thing. So it's really, it really can be a great resource. I know I look at it often when I'm trying to figure something out. So thank you for listening, and we're going to see if there's any questions from the chat room.
Just that people did not receive the slides ahead of time, so we will resend the slides out.
Okay, we'll resend the slides out.
And we're opening the lines now. Olivia, can you open the lines for any online questions?
Yes, no problem. If you would like to ask a question, you just need to press #6 on your phone, and that will unmute your line. That's #6.
Hi, this is Carol from Connecticut. I have a question on slide 48. The question slide 47, about the HAI for the rehab hospital. So since it was false that it was not a HAI for the rehab hospital, should the rehab hospital call the transferring hospital to let them know about this HAI or this CAUTI?
I think it makes sense to let them know, and then they can follow up and get whatever data they need to follow through. I would think so.
Excellent. Thank you.
Thanks for asking.
We do have one question.
Okay.
Back on slide 37 or so, related to the device-associated infection. Okay, when we go back and look at that, I can check my understanding. Let's go back.
Okay, so that 30, okay, so would that be the device-associated example number 2?
Yes.
I don't know if she's going to answer.
Number 35.
Yeah, but 37 is the question, is the answer. Okay, so let's go over it again. On day 1, the patient came to ICU. Day 4, the Foley was inserted. Day 8, the Foley was removed. Day 9, no Foley. And day 10, fever and positive culture. So we have that as a CAUTI. The date of event being day 9. We're calling it the date of event because that's your first symptom. Your fever is 100.5, which is greater than 100.4. The Foley, and if you're looking at the Foley being in place, because we have to look at those 3 different criteria. it looks like it went in on the 4th, 5th, 6th, 7th, 8th. So it was on the day of your first symptom, the Foley was removed the day before. So therefore, in addition to the positive culture, you meet all 3 criteria. So hopefully that makes sense.
Okay, let's try the next one, guys.
Try the next question again? Okay. So that would be device 3. Okay. So just to recap, admit to ICU on day 1, Foley inserted on day 4, removed on day 8, reinserted on day 9, and then 10, the temp was 100.6 with the positive culture. And we said, true, this is a CAUTI. So day 10 is the day of event because you have your symptom, your fever. The Foley was in place greater than 2 days.
Because there wasn't the full 24 hours.
It got removed on the 8th and reinserted on the 9th. So there was no full calendar day without it being present. So it meets that criteria, the symptom, and the colony count. So it would qualify as an NHSN CAUTI. I hope that makes sense.
Okay, thank you.
Oh, good. Okay, great. Any other questions?
And again, online, you can just, they're all unmuted or they are not. They have to press pound 6, Olivia.
You just need to press pound 6 to unmute yourself. If you unmute everyone, you might get some background noise, so we like to keep it muted. But again, it's pound 6 if you'd like to ask a question and unmute yourself.
We have a question here from Rhode Island.
Okay.
On device example 4, the reason it is not a catheter-associated urinary tract infection is because it wasn't in greater than 2 days. It was just 2 days.
I'm sorry, can you say which one it is again?
Number 4.
Dysuria 4?
Yeah. It's a symptomatic urinary tract infection, but it's not catheter-associated because the catheter hadn't been in greater than 2 days.
The catheter was in the first part, it wasn't in long enough. So it's going to begin on October 12th. Because you had a gap day, right? Full calendar day in between those 2. So then the fever on the 12th, greater than 100.4, is going to be your first element. So that's going to be your day of event. And the Foley hadn't been in for 2 days on that date of event. And it wasn't removed the day before. So that it's a UTI, but it's a non-catheter associated.
Because the second time it hadn't been in for greater than 2 days.
It hadn't been in the
time. Right, the second time. Exactly.
Okay.
There is a question about this, the recording, and it will be on our website. Olivia, when should they expect that?
In a few days. Usually WebEx gives it to us within, a week, but it's usually earlier than that. I would hope it would be up. But it is a holiday, so I would hope early next week it will be available.
Okay.
Okay, any other questions?
Any other questions?
We have a couple more minutes if anybody can think of anything else.
Okay, I guess if there are no questions, we are very happy and would like to thank you all for this great discussion. I just have a few last-minute announcements before we end the call for today. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill it out, we greatly appreciate your feedback. If you don't have time to fill it out today, the evaluation right now, or you are currently sharing a computer with someone else, you'll receive an email tomorrow morning with a link to the evaluation, as well as a link to the event page on our website. And that is where in that link, you will be able to access the recording, as Olivia said, in a few days, probably the middle of next week, or maybe more towards the end because of the holiday. The PowerPoint presentation is posted on our website, and within the next few business days, I'm repeating myself, the recording and the transcript will also be added. Be on the lookout for emails about our next webinar, and thank you again for attending. Have a great day, and we're giving you back 7 minutes of your day today. Goodbye, everyone.